Patient has no response. Person is not alert to verbal. Sir, can you hear me? I'm from the fire department. What seems to be the problem? All right, the patient is moaning with pain. So at this time, due to the nature of the call, I'm going to go ahead and mobilize and take C-spine immobilization. All right, so I'm going to have my imaginary partner hold C-spine in this patient. We're going to log roll on C-spine's count. So at this time, we're going to go ahead and log roll on C-spine count. Ready, go. Go ahead, roll over later. All right, so we got the patient still in neutral inline position with his spinal mobilization. From here, I'm going to do a rapid assessment. I noticed the patient does have deformity to his head, so I'm going to note that. I do see major bleeding in the patient. My patient does have fluid coming from his ears as well. I'm going to check my patient's nose real quick. My patient is missing teeth. I want to palpate my patient's chest. All right, nothing noted. Well, as his pelvis, nothing noted. Leg, nothing noted. Right leg, nothing noted. I'm going to check for PMS. I do have lower pulses present, but at this time, due to the nature of my patient, the pulses are thready and weak. Check the patient's arms once over. Nothing noted. Arm again. Nothing noted, but the patient's skin is cool and clammy. All right, from here, I'm going to take my first set of vitals. I'm going to listen for lung sounds. All right, lung sounds are diminished. At this time now, I'm going to also take blood pressure.
I just killed a spider.
Normal vital signs will be 100/80. Due to the nature of this call, vital signs in this patient will be approximately 70/80 or 70/60. Signs and symptoms indicative of decompensated shock. Pulse reading will be a 70, but due to this incident, pulses are diminished and at a 30 at the moment. Respirations are slow and shallow. At this point now, I will go ahead and have my partner continue with C-spine immobilization. We'll put this patient on a backboard. So at this time, I'm going to have my imaginary partner go ahead and we're going to rotate him towards me to put him on the backboard. So on C-spine, we're going to roll him over. Ready, go. And We'll check his back for any step off. Any step off, decrepitous, any major bleeding. I'm gonna check his buttocks as well. I see nothing. I'm gonna put him on the backboard right now, on C-spine, ready to go. So now he's on the backboard. We're gonna get him strapped on the backboard, load him to the ambulance, and this is where we're gonna do our detailed secondary assessment, our head to toe, and then our detailed secondary assessment. All right, and from here, what I want to do now is my detailed head to toe assessment. So I'm going to check him over. I'm going to check his head. I note major bleeding. All right, I'm going to check his eyes with a pen light to see if they're reactive to light. Due to the nature of this call, the patient's pupils will be unequal in size due to head trauma. All right, I'm going to check the patient's nose. Note any major bleeding. I'm going to check his mouth to note any major bleeding or any contusions, decap BTLS. I'm going to check his ears as well to note any cerebral spinal fluid leaking, any bullseye present. So I'll grab a 4x4 to see if I see any cerebral spinal fluid on the 4x4. All right, I'm going to check his neck. I'm going to look for JVD or any tracheal deviation. All right, I'm going to palpate his clavicle for any decap BTLS. I'm going to check his chest for any crepitus, any deformities as well. All right, I'm going to palpate the patient's abdomen. Noted nothing. Checking for decap BTLS as well. Any rebound tenderness, any firmness as well. I'm going to check my patient's pelvis. Make sure there isn't any crepitus as well. Any step off, any deviation to one side or the other. I'm going to palpate my patient's leg. See if there are any deformities, contusions, and abrasions. At this time now, my patient will be trauma naked, so I will cut off all his clothing as well, just to get a better picture. Nothing noted. Check his foot, nothing noted. Sir, do you hear me? Can you hear me, sir? My patient is making incoherent sounds. So at this time, as I'm doing my secondary assessment, I will also notice this patient, note this patient has a 6 GCS score. I'm gonna check my patient's other leg, foot, nothing noted. I'm gonna check his upper extremities. And for any decap BTLS, nothing noted. Same with the right arm. Nothing noted. At this time now, I will also have another fire personnel, another EMT bagging this patient due to the first set of vitals. So this patient will be bagged at a rate of 10 to 12 breaths per minute. Be a non-rebreather, be a bag valve mask, pardon me, at 15 liters per minute. We're going to be monitoring oxygen level stats as well, and have this patient on capnography with the bag valve mask inserted as well. Due to this patient's trauma, while we're bagging, we'll probably have to intubate this patient. Due to my level as EMTB, I will automatically jump to the supraglottic airway, noting that I'll have capnography on it as well. From this point here, I will, this patient will be a priority patient. I'll reassess vitals every 5 minutes. And on my HEAR report, I would say I have a approximately 70-year-old male who suspected head trauma. Dispatched to the call. My patient initial vitals are as follows. He has a blood pressure of 70/40. Decreased respirations. He is getting bagged via a bag valve mask. He has been intubated as well with a supraglottic airway, hooked to capnography. His capnography levels are as follows, which will be a normal, be 35 to 45 range. This patient bagging, being that his breathing is slow and shallow, will approximately be much lower, maybe in the 10, 15 to 20 range as well. Like I said, I would note all major bleeding. I would note that the patient also has unequal pupil size. The patient also has a GCS of 6 as well. And I'm done.